This is your Houston chiropractor, Dr. Gregory Johnson. We've got Nui in here with us this morning, and Nui's all the way over here from Oahu, Hawaii. And Nui comes in complaining, his primary complaint, the thing that he's been dealing with for how long now?
8 years.
8 years, is he has been diagnosed with hiatal hernia. He gets severe acid reflux. It goes all the way up into his throat. He has to like throw up acid sometimes, right?
Mm-hmm.
And then, you know that we do not diagnose or treat acid reflux, hiatal hernia, or GERD, the disease here, but we do evaluate the patient's spine and subluxations that can be attributed to the underlying cause of that, which is the thoracic spine subluxations and rib cage subluxations. And he has a condition that's very prevalent amongst people who have been diagnosed with acid reflux and hiatal hernia, and that's the fight or flight anxiety that he gets. It makes it difficult for him to take deep breaths and get that racing heart, restricted just anxiety.
Yes.
It's called fight or flight. That's a sympathetic nervous system disorder, usually from hyperactive sympathetics. He gets some neck pain, stiffness, low back pain, stiffness, right knee pain because he had a ruptured patellar tendon back a few years ago and had that surgically repaired. Let's see, did I leave anything out? I think that got it all. So this is Nui's very first adjustment here at our office. So we've already done his history and orthopedic neurological examination. Was that thorough, by the way, Nui?
Very.
Okay, let's have you lay on your stomach for. He gets adjusted once a week, by the way, down in Hawaii, right?
Correct.
So in evaluating him, we'll check leg length. You can see the right one's short by about 1/2 inch. I bring him up, it stays short by about 1/4 inch, but that tightens up in his lumbar spine. So that's a semi-positive Deerfield and a positive Nautilus. He does have some right SI joint palpatory tenderness. L4, L5 is the most prevalent in his lumbar spine. And then you get into this lower thoracic spine where those ribs attach to the T11, T12 vertebrae. You can feel a lot of paraspinal hypertonicity and rib cage subluxations there with its lower thoracic spine. Mid-thoracic spine's dished out on the anterior. I knew he's a big guy, so I'm going to get my old man workout this morning. Bilateral trigger points in his traps. He's got about 3 up here in his cervical spine. So this is his first adjustment, so we're going to leave him on the BioPhysics table first. I'm going to start off with your pelvis, Nui. Deep breath. There you go. Well, looky there already, though. Now it's only about 1/4 inch short. Stays it tightened up as much as the first one? Nui?
Yes.
It did?
Nope.
Oh, it did not?
Better.
Okay, good. Breathe. Man. Ring dinger's gonna fit you just fine. See, that helped his leg length even. Does this feel easier?
Yes, it does.
Okay, good. You're gonna feel your head popping up on this next one now, Nui. Slide down this way just a little bit. There. Good, okay, let's turn you on your back, please, sir. I'm gonna bring your whole head up and over your spine. Yep, now slide down about 1 inch. Put both arms out like this for me. He also has a bad right shoulder. We got in his history, slide down about another inch. There. So I'm gonna adjust that AC joint, clavicle, anterior ribs. You don't have a lot of disparity on your lower rib cage alignment. It's a little bit lower, about 1/2 inch on this right side. So I'll adjust that back up. There you go. Okay. You can relax your hands on your stomach now. Let this one relax in my hand. Very good. You should have felt that from your knee all the way up to your lower back. Good. Breathe this one. There we go. Okay, slide back up that way. Put your hands on that headrest. Put your hands up here on your chest now. All right. So in doing this, I'm pulling his fascia down, which helps line up the lower rib cage. Take a deep breath in. Exhale. This is gonna feel deep and probably pretty sore at first. Good, and deep. Keep blowing that air out for me, Nui. One more time. A little deeper in person, huh, Nui? Okay, I'm just gonna check your ileocecal valve here. Is that sore?
Yep.
Wow. When you make a big man like this squirm, that's sore.
It's like locking up.
Do you eat popcorn or nuts or anything with husk on them?
No.
Because that'll sometimes stop that valve up.
Oh, shit.
Sorry. You can rub on that yourself, by the way. Clockwise always.
Okay.
I'm still going to do it a little bit just to... Yeah, sorry. I know it's smart. Should get a little easier, though, once I get relaxing. That wasn't quite as bad, was it?
Nope.
Good. Okay. All right, let's have you sit up, face that way. Okay, I'm gonna adjust this right shoulder. Keep that chin up. Okay. I can barely get my arms around you, Nui. Yes, sir. Good. Good. Okay, let's come over on this table next. Now you're fine there. You got a front row seat. Butt here, Nui, head up this way, please, sir. There we go. I'm gonna raise your legs up with the table. Just let them relax. He's a little bigger than the average bear, so I pushed 2 on him, Tristan. Yep, see? So that's parallel for you, Nui. This is how I'd recommend you start trying to sleep. Your spine will heal up better, and it takes that compression stress off of the diaphragm too. But don't be sleeping with the big pillow. See how his head's reversed now? When you lay your head all the way back, you got a forward curve here, and that's what's normal. I'm gonna pin your pelvis in here with these big old pins. Man. There we go.
Oh, shit.
Yep. There, okay. You're not gonna get away now. All right. Lift your head up just a sec. There you go. Now let it back down. On this one, you want to keep your teeth together. No, you don't bite your tongue. Breathe through your nose. Just like that.
Oh.
Now, you should have felt that go all the way down your spine. Did you?
Yes, I did.
Good. And looky there, you're still kicking. Tilt left. Yes, sir. Tilt right. Yes, sir. Good job. So when you get up from a lying down position, always turn sideways. Bring your legs over. Let me help you up this first time. But you'll kind of want to push yourself up with your arms sideways. Anything that puts your spine into flexion is a detriment to your acid reflux condition. So, because you're pulling the stomach up even more. So avoid this. Forwardness, flexion.
Okay.
I'm going to show you an exercise here in just a sec. It'll put you in extension. And that's what'll help you line up your own rib cage.
Okay.
I'm gonna use this instrument first just to bounce the muscle spindles and relax your paraspinal muscles, Nui. Feel that right side's tired. You feel that right there?
Yep.
All right, so here's your homework. Your head's a little forward, pulling your shoulders forward, which causes those ribs to come up on top of your sternum. That's why you get that tightness in your rib cage.
Okay.
So shoulders up, back like this. Okay, try not to jut your head forward. We're gonna bring that head straight back this way, then look backwards. You're gonna feel a little tap on your atlas there, and there. Now relax. Now, just relax everything. Go ahead and go forward and backwards again and see if this feels any easier to you.
Uh-huh.
Smoother, huh?
Mhm.
Take a look at your posture in the mirror already. See how you squared off? So this helps those ribs line up. That's 1 rep. 2 reps. 3 reps. Just do 15 of those in the morning, 15 around lunch, 15 in the afternoon or early evening. That'll help you keep your head up over your spine. You won't stress out your thoracic spine so much, which I believe is the underlying cause of your hiatal hernia.
Okay.
Well, this is your very first adjustment here at our office. He's been getting good results from his chiropractor in Oahu, right?
Mm-hmm.
And you see him once a week. You want to give him a shout out?
Yeah, Dr. Armando Garza.
There you
He's
go.
been helping me a lot with the breathing.
And Armando, if you want to come over here and take our seminar and learn how to do the ring dare technique, you wouldn't have any aversion to that, would you?
Not at all.
You can go to Advanced Chiropractic Equipment LLC and fill out a seminar request, and we'll get back to you with seminar time, and you can take the seminar and learn all these techniques that we just did. Would that be beneficial to you?
Very. Yes.
Because you're probably showing this video because it's on you. Yep, very good. What would you say to our rest of our crack addicts worldwide? And those crack addicts, you said there was a bunch of them in Hawaii already, right?
Yeah, they're up here with us.
Oh, they are.
They were all excited for me coming up
Oh,
here.
good.
Yeah.
Cool.
So it was everything I thought it was going to be.
Oh, good.
It felt exactly how I thought it was going to feel. It
Well,
was
super.
awesome.
So it met with your expectations?
Absolutely.
Super duper. Well,
Yes.
thanks for sharing your experience with everyone
Thank
today,
you.
Dewey. This is your Houston chiropractor, Dr. Gregory Johnson, coming to you from Advanced Chiropractic Relief in Houston, Texas, with Dewey from Oahu, Hawaii. We'll see y'all soon.